I want to look like myself. I want to look natural. I don't want to look overdone. I get that question so much. I'm scared of migration. Gosh, am I going to look like, a housewife basically? I'm like, do I look like a housewife? Right? I mean, like I've had filler. I kind of ask, okay, so if you get migration, so what? Can you drink out of a straw right after you got lip filler?
Filler is not the problem. It's,
Technique.
Welcome to Behind the Needle with Weiler Plastic Surgery. I'm nurse practitioner Hyaluronidase, sharing expert insight on injectables, skin, and the science behind aesthetic medicine. Welcome back to Behind the Needle podcast with Weiler Plastic Surgery. I'm Hyaluronidase, your host, and today I have one of my very good friends and expert injectors, and she's a nurse practitioner at Weiler Plastic Surgery, Chelsea Barbe.
Hey guys, I'm excited to be here.
Yes, thank you so much for having me.
Yeah,
How's your week been?
It's been great, busy, but so good, so fun.
What'd y'all do last weekend? I know you're probably, I saw your snap stories of like you with your kids and baseball games.
All the kids. So we're doing baseball for the 6-year-old and the 4-year-old. So
fun.
We're at traction a lot. And then the 6-month-old, he's just along for the ride.
I know, the third baby. He's
sweetest.
Just so easy. We've talked about
the
that.
Sweetest.
They're
just obsessed.
So good. I'm like, they just don't
They make
complain.
you want 10 more.
I know. So Sunday night, we had family come in that are from, we never get to see from North Carolina. And it was so funny because, he only had one nap. Devin had brought him to the baseball game. He only had one nap. And then we went and hung out with them until 9:30. And
just so go with the flow.
I mean, he was a little whiny here and there, but he didn't fall asleep because he's too nosy. And he
has to be in the know. Yes.
I'm like, that third
They're
baby.
just the best. Oh, so sweet.
I love it. Well, last week was crazy because it was our WPS Fest.
So fun.
That was so fun.
Yep. I love that week. I love the theme. I think it's so fun with the colors. We get to dress up. I mean, who doesn't love to dress up,
scrubs every day.
Yeah.
I know. A lot of patients, and I had said that earlier, I was like, they were like, do y'all wear glitter every day? And I'm like, no, but I wish I could.
I wish I could because it just
scrubs,
it just brings the mood up, It's so positive. Yes. It's so fun. It's the best. Yeah.
Yes. And whenever, I kind of reached out to y'all, I was like, okay, what's some trending topics and stuff? And I've seen it all over social media, but, we have a really good specials on filler that week. So we get these questions, they flow in, and a lot of patients are so scared about filler migration.
Yeah, for sure. I feel like, especially for new patients that I see, their first two concerns, number one, I want to look like myself. I want to look natural. I don't want to look overdone, always. Number two is always migration. I get that question so much. I'm scared of migration. And I think that that's a lot of social media driven.
That's what I was going to say.
That you see a lot on social media.
Because you see the worst. You're going to see, nobody's posting about their filler that doesn't look, you can't tell that they got it done. They're posting oh, look at this migration. Or some things they think are migration isn't even migration. That's their normal anatomy. But yes.
Yeah, for sure. Yeah, I think there's a lot of fear mongering on social media. And I tell this to patients when they bring this up to me. There's a lot of bad filler on social media, right? But there's also a lot of good filler out there that, like you said, is undetectable because to me, that's what filler should be. It's undetectable,
Yes. I feel like migration really screams and invisible filler is just so
it's silent. Yeah, yes. I love that. Yeah, exactly. I think that that's so true. And that's important,
So explain to our audience what is kind of like filler migration and that aspect. So if somebody's listening and they don't really understand or know what what that means.
Yeah. So essentially what migration is filler moving to an area of tissue where it's not meant to be, where it's not placed. So most common area that's going to occur is in the lip. So it'll come outside of the lip at times or can move into what we call this wet, dry border in the lip. The reason that is the most common area is truly just the anatomy, right? So our lips, we move them all day long.
Talking,
we move that muscle,
drinking.
We talk, we eat, we do all the things. So if that filler is not in the correct area or it's not the right product for that patient, it can come out of the lip, right?
For sure.
I tell patients that that's not super common, even though that's what we see on social media. My 3 things that I tell patients, migration can happen when it's the wrong product in the wrong area of tissue. So it's either injected into the muscle or too superficial.
Yes.
Or it's too much. And it's really that simple.
And sometimes it is to anatomy thing too. I've learned that in our years of practicing that sometimes it's just some people are just more prone to migration and that's okay.
Yeah. Absolutely.
We have tools to dissolve it and
100%.
take care of it.
Yeah. I kind of think of it before I was an aesthetic nurse practitioner, I worked in cardiology, and I tell patients that everything that we do in life, every single aspirin that we take, every blood pressure medicine, every single medicine has a side effect, right? It's the risk of, are you going to develop that side effect or not? But don't let the risk outweigh the benefit. And that's what I feel about filler, right?
Yes.
Don't let the fear of migration scare you away from filler.
Yes, because they think like every single person who gets filler in their lips is going to get migration and they're going to look like a duck. And I'm like, no.
Yeah, absolutely. And like you said, we have ways to reverse that, right?
Yes.
The good thing and the bad thing about filler is it's not permanent, right? So it's going to go away eventually. And if you do have migration, then we have ways to reverse that.
Because I've had patients come in and they'll have just a little bit, you know, the upper lip or a little bit in that wet, dry border.
Yeah.
And you can just titrate that. I'm like, I don't have to dissolve your whole entire lip. I can just dissolve that part. Now, if you want to start over, yes, we can. But I think, you know, just educating them on that aspect. And a huge thing is like going to someone who is trained on knowing the right product for the right plane and how to do that. And I feel like at Weiler Plastic Surgery, we're all trained very well on that. And that's the most important, instead of just like, oh, this is the only product I have and I'm going to push that into this person's lips.
Right.
You know, especially lip
whether
filler,
it's good for your anatomy or not.
You can put like a bigger filler in. Now that filler you might not be able to use on like tiny little lips because it probably will migrate. You think they're going to go to path of least resistance.
That's right. That's right.
So
I tell patients that too, that I really love Weiler Plastic Surgery so much because Dr. Weiler invests in our education and our training, right? We are a representation of this company, and it's important that you see an injector who knows facial anatomy, right? That's number one for safety and to get the best technique and get the best result.
100%.
And we are trained specifically to do that. So I think that we're really lucky in that sense, and it's important.
So lucky. And I mean, too, we have like such a, you know, huge group of us as mid-levels that we treat. So like we can fall back on, you know, any of like the other ones who have maybe experienced that, or Dr. Weiler and any of the surgeons, like they're always open ears. And
that's right.
A lot of people don't have that, which is, you know, I mean, we're so fortunate in that, and the tools and stuff too for migration to prevent that. And through all of our trainings, it's like really amazing.
Absolutely.
I think that gives like a huge aspect to why we do what we do and why we're, I don't know, in my opinion, the best of the best. So.
That's right. That's right.
So, okay, signs that like a patient, if they're looking in the mirror to kind of, you know, see like, you know, we know what to look for for when we're looking at migration, but what are signs that patients, and two lips are not the only thing for migration can happen, but that is the most common and the most obvious typically.
Correct. Yeah. So some of the signs that they may notice that they don't even realize are migration, like specifically to the lips, would be kind of that fullness above the top lip here. So what that can do is kind of dull the border, right? So we all kind of want that crisp, pretty border to accentuate our lips. And if you have migration up here, it becomes difficult to differentiate the border from that fullness up there. So that's kind of something that I would say most patients, if they do have migration of the lip, that's what they see.
Most noticeable for sure.
But to your point, you can have migration in other areas. For example, the tear trough area
another big one,
is a tricky place in general, right? The under eyes are kind of tricky. So migration there can look like puffiness essentially, because filler is going to draw in water, right? So again, knowing the anatomy, knowing where to place the product, what product to use, because some products pull in more water than others, right?
For sure.
So knowing which products to use in that area and which amount, I think is the best way to avoid the migration.
I think so too. And like you gotta think swelling is normal after filler.
Correct. Right.
Sometimes when I swell, like after I get my lip filler, my top lip will swell and it looks like migration, but migration is going to stick around and it's not going to stop swelling.
That's right. Yes.
And, you know, sometimes too, and I've had patients after prep that still know when they get filler, you know, in the mornings, everybody's a little puffy. So they're like, I think I have migration. It's puffy in the mornings. I'm like, no, that's
totally
not
normal.
By the end of the day, if it's normal, then that's not migration.
Right. Absolutely.
And two, with the under eyes, you can get like that little blue effect too.
That like hint of,
that tissue is just so thin under the under eyes. And so it's so tricky sometimes to under eye filler. I feel like the most we ever dissolve is probably lips and under eye filler.
For sure.
So,
yeah, I totally agree. Yeah.
I mean, and you know, if patients are ever concerned or, you know, you're ever like looking at yourself, come see an injector that is experienced in that. And that way they can tell you, you know, how to treat that or how to, if you have migration or not. Or if it's even
necessary to dissolve it. Because there's patients sometimes that will ask me, like, do you think that this is migration? And like, if they're new to me, they were injected somewhere else, they come in, they ask me if I think it's migration. Maybe it is and maybe it's not. Sometimes, like you said, we do need to dissolve. And sometimes I'm like, no, it's fine. Leave it. we don't need to touch it. No one notices it. Your lips still look amazing. So it's really patient dependent.
Yes. And I mean, beauty is in the eye of the beholder. I do have some patients
That's
that
right.
have lip filler migration and they like that.
They love it. Yeah.
Some older ladies, they do because it gets rid of those little perioral lines.
That's
I'm
right.
like, beauty is in the eye of the beholder. Maybe not my aesthetic, but
Yeah.
that is what theirs. Now, if anybody is interested in dissolving, walk me through that process and
Okay.
like how you handle that.
Yeah. So that'll first, of course, start with a consult, right? We will, I like to give the patient the mirror so I can point out to them what I'm seeing. Okay. And like to your point, like you said, is it something that bothers them? If it is, then that to me is like, okay, we need to take some action and go ahead and dissolve this. Okay. So if it's an area that we have decided we need to dissolve. So basically what we'll do is we use something called Hyaluronidase, which is an enzyme that's going to break down hyaluronic acid. Okay. So I will numb the patient topically to kind of take away the burn. And we inject this Hyaluronidase into the area where the filler has migrated. And that is going to break down the filler.
Yes, yes. And so what is like, do the patients, you know, need to not do anything after, or like, how do you kind of tell them for the
So
downtime?
I tell patients that they're definitely going to have some swelling, right? So swelling with Hyaluronidase, totally normal and
Bruising too,
expected.
probably.
Bruising, yes, very normal and expected. I want them to ice that day. And then I personally will not refill a patient for at least 2 weeks. Okay. And the reason for that is because that Hyaluronidase can still be kind of in the tissue. And if we just go ahead and immediately refill,
For sure.
it could be breaking down as we refill. So I want at least 2 weeks. Usually I'll bring the patient back in at 2 weeks. And once all the swelling is gone down, see if we need another session of dissolving, because sometimes it just takes one.
Yeah.
Sometimes it takes multiple to dissolve everything.
Yeah. And depending on the filler, I've seen how many syringes of filler have they had, or the different types and different things. They all dissolve differently.
Right.
You know, filler does eventually, you know, kind of
Break down.
Yeah,
right.
and you metabolize it. But sometimes that you do have some that stick around, and it does take a little bit more. So coming back in. And then another thing is I'll make them I'll make sure I'm doing a whole consultation and looking at everything because and really assessing them, because sometimes that tissue is not ready to be injected, which, you know, I don't like to tell you no either, but also if your tissue's not ready, it's just going to fall back to what it was. And you're going to be migrated again.
Right,
Because sometimes you'll see that little, like inside when you dissolve that, they have that little hanging tissue. And I'm like, I have to explain them, and they're disappointed because they don't like to be deflated. When you're used to looking at your face a certain way for so long, it is kind of a shock when they see their cells dissolve. Like, you know, they really have to do some self-reflection. It almost goes to when we do the saline deflations. Like,
exactly.
You know, it kind of like messes with their mind. And they're
when
like,
you're used to looking at something every single day in the mirror, it's a little bit of a shell shock, right? But
you
it's for the best in the long run.
Yes,
you know?
it's going to look so good after. Like if you see the before and afters from like before they came in, they had migration, you dissolved it, and then the filler after, it is beautiful. But just trust the process. It is a long process sometimes.
It's a process, right? I don't know about you, but I've really never had a patient who had true migration who I've dissolved who was regretful that they dissolved. They've all been so happy because then we can kind of achieve what they're actually looking for, right? We can get that crisp border. We can, you know, get rid of the puffiness to the under eye, those kind of things that we couldn't achieve with the migration.
For sure. No, I agree. They may be at their like comeback appointment when I'm like telling them, okay, we need to dissolve again, or we can't fill today. They may be disappointed, but when they do come back in to get their filler, they're like, oh, why did I not do this years ago?
Yeah, exactly.
They're absolutely excited and they love the results from it. And then they trust you too.
Yeah, absolutely. I think one thing that's super important too about the dissolving is making sure we're lining it up and having a good game plan. Like, of course, you wouldn't want to dissolve, you know, 2 nights before a Mardi Gras ball or something like that, right? You want to give yourself time to let the bruising go down, let the swelling go down. And I always tell patients, most bruising and swelling is going to, you know, hang around a week or so, but give it 2 full weeks, let everything kind of settle.
For sure. Because you know, I do warn them that they're going to swell after. But, you know, I like to say, let's plan, let's reset, and let's rebuild.
I love that.
It's going to be absolutely beautiful.
It's worth it in the long run.
I think they trust you at the end of it.
Yeah.
And I mean, social media just has like really drawn in people about it and like really scared people. So what is your advice to anybody who's like kind of thinking, oh, I maybe have migration, or they're kind of want to get rid of their migration, or kind of they just want to start over and dissolve? Like, what is your advice for them?
So like I said, I tell patients all the time, you know, don't let the fear keep you from doing something, right? I mean, I think it's so important because truly good filler can be life-changing for your confidence, right? It's beautiful, it's soft, it's you, and it really just like elevates you. It refreshes you.
It really does.
So I think that letting the fear overwhelm you that, oh, I could have migration, I kind of ask, okay, so if you get migration, so what?
Yeah.
We dissolve it
Yeah,
and we fix it, right? So don't let that fear drive you from not doing what you really want to do. And don't let social media is so amazing because it truly is such a wealth of knowledge that we maybe wouldn't had previously, but it also, on the back end of that, there comes things that kind of scare you,
spiral
right?
And research and
absolutely
almost open up when they don't fully understand things, and
that's right.
Creates all that fear mongering.
And that's why I think a consult is so important, right? Because we do this all day long, Monday through Friday. Okay, we do injectables, so we truly, when we say expert injectors, we truly are expert injectors because that's all we do. So going to someone that you trust, I think, is so important. Going in and asking those questions, because I'm always going to tell you honestly what I think.
Yes.
I will always be upfront with you. And I think that that is really important to have in a provider.
I agree. And I was just telling a patient this yesterday. At Weiler Plastic Surgery, we have this huge team of everyone, but also too, like, we have so many different avenues that we can take. So like, if I think surgery is a better fit for you,
that's right.
If I think, aesthetics is a better fit for you, or if I even think like, I'm a better fit for you, I'm going to send you the right way, which I think it gains their trust. So go to someone who is not in it just to like do the procedure and get out and get in, come to somebody who's actually cares about what you are wanting in your aesthetic and actually going to get to the root of problem.
Right.
Is going to address it. It's going to be honest with you. Isn't just going to like, oh, let me just, put more filler
put a
in
Band-Aid
there
on it.
to
Right.
like
Exactly.
make it better and to fix your problem, which, people pleaser myself. I love to make people happy. So sometimes I'm like, I don't like to have those hard conversations where you're like, no, you can't have any more filler because you are going to have migration, or you already have migration. We need to solve it. So yeah, I'm like, I'm sure you get those tough conversations too.
Absolutely. Yeah. I think it's part of the job, right? We have to do what's best for the patient in the long run. And so sometimes that does involve kind of tough conversations, but I would say that every single patient is so open to those conversations,
And I mean, yeah, I agree. Cause helping them understand that and educating them that filler is not the problem. It's,
technique.
It's
exactly. How it's used.
Yes,
exactly.
It's the right plane. Yep. It's all of those aspects play into why the migration happens.
That's right.
And, going back to what we said earlier, is that almost like you're seeing all the people that have migration because it's so obvious. The people that are getting filler and Botox and all the other things, like, you don't really notice it because they just look refreshed.
Exactly.
There's so many people walking around that do not want you to know that they have filler or Botox or any of that, and they do, and you just don't notice because you're like, oh, they just look good. You think, oh, they have good genetics, or oh, they must have a really good skin cream or retinol or something. And I'm like, no, that person has tons of filler in their face. I mean, I really surprise people a lot. Like, even last week when we were, talking about filler with patients, they're like, oh, I can't do lip filler. It's going to make me look it's going to migrate or something. Right. I'm like, you would be surprised. I've done 10 syringes in the last year in my face. Yeah. And they are like thrown out the chair. They're like,
I feel like that's something that I ask my patients a lot, especially someone who's new to filler. They're like, oh my gosh, am I going to look like, a housewife, basically? I'm like, do I look like a housewife? Right? I mean, like, I've had filler. Yes. I do filler frequently. I do Botox. I do Sculptra, microneedling, all the things. And I don't want to look like that, right? Yes. Like, I want to look natural. In the South, we want to look natural. That's our aesthetic. And I want my patients to look like that too. And so I think that comforts them a little bit. Like, oh, okay.
So I think
you don't have to look crazy,
and
right?
Then, too, they're on the same page as you. So you're understanding their goals and what their aesthetic is. And they're like, oh, okay. I'm like, I don't want you to look crazy. Unless you want to look crazy. If that's what you want,
if you ask for it, we can provide.
But most of them, like, I want you to look natural and refreshed too. Right. I want to make you happy, and I want you to keep coming back to me.
Exactly.
I want to have this relationship with you. And they're like, okay, yes. I'm like, I promise I'm not going to just tell you 5 syringes because I think let's just put it everywhere else. I'm not.
Yeah.
No, and I'll spread those out between sessions, which that can prevent. So let's talk about some things that we can like do to prevent, migration. One of the big things is, depending on the lips, we have to work on them very slowly, because lips are that, like, the muscle that probably pushes them out the most and causes the most migration. But sometimes you need to put those over a couple steps. Like,
yeah, for
you'll
sure.
come in, we'll see what we can do for your lips that day. And then I'll have you come back in 2 weeks and we'll finish it off. And sometimes you don't need the rest of that syringe, or sometimes you do and you might need more, but we're going to take a little step and slow the process. And maybe in a couple of months, come back and we'll add more filler.
Yeah, I completely agree. I really like to build. I think that it gives the best result in the long run. And for all my patients out there, I'm bringing everybody back at 2 weeks with lip filler because once you start swelling, right, you're swelling because of the injection, okay, which is totally normal and expected. Once you start swelling, number one, it's hard to know like what is product versus what is swelling. And I'm not chasing that all day because then otherwise you're kind of chasing your tail.
Yes, and you can chase that. Like, it's hard to see then you start getting on with asymmetries too.
That's right. So. Exactly. Yes. So I will inject to a certain point, bring that patient back at 2 weeks. And then, like you said, we decide together, where do we feel like we need a little more? Where do we want to touch up? And I think that really helps decrease the risk of migration. But some patients need multiple syringes because they have a naturally larger lip, and that's perfectly fine. And that is just something that we have to build on for sure.
Yeah, I agree. I work with the same thing. I like, my patients know I want you to come back at 2 weeks. We're not going to put the whole syringe in.
That's right.
Some of them I can though, depending on the anatomy
for sure.
of their lip. But I'm like, let's, take this slow. I like the slow process. Let's build on top of it. And I think that gains their trust. And it's usually a better almost downtime and recovery for them too. Because the second time you're not going to swell and bruise as bad because it's not as much going in there. It's not as much.
That's right.
We're usually just like putting that icing on the cake.
That's right. Exactly. Okay. Here's a question.
Yes. I love this.
This made me think of it. So when it comes to migration, how often would you say you are dissolving your patients?
Depends. So if they're a new patient to me, before I touch them, if they have migration, I'm going to dissolve it because I'm not sure what's in there. I'm like, let's, figure this out. If it's, one of my patients and they're, dealing with migration, we've done, and be honestly, like we see migration. I have migration myself and I've been injected by the best injectors with the best products. So yes, some of my patients, they have smaller lips. They may get some migration.
Right.
Just depends.
It's very patient dependent.
Yes.
Yeah, for sure.
I will point it out to them. Like I said, everybody's different. Everybody
if it bothers you,
it may not bother them.
Right.
But I'm like, I do see a little bit of migration here. I will kind of preference that, like, hey, before we do your lips again, before I touch them, I'm not going to touch them until we dissolve some of this.
Agreed. Yes, for sure. To come up with a game plan.
Because sometimes, they're used to seeing themselves that way. They have to kind of wrap themselves around, hey, I'm going to have to dissolve this.
Right.
And I explain, I'm going to dissolve the spots. I can do here or here before I actually do the lips or something.
For sure.
To make it, a little bit easier for them. So I think they're,
Yeah, same. I completely agree. Me too. I've had a few patients ask me recently, I'm sure you've gotten this too, from social media, can you drink out of a straw right after you got lip filler? What do you say?
I think it's fine.
I do too.
Okay. Yeah, I think that was like a thing that people migrate or something.
I've seen that video of that girl where she said she got lip filler and then it molded to the straw. My patients are like, is that going to happen to me? I'm like,
I get that a lot. Yeah.
No, I'm drinking out of a straw.
Yeah.
It's completely fine.
No. I know. I'm like, I would think you would have to be because the filler is still moldable for a little bit.
For sure.
I would think you'd have to be like really honing in on that straw to like make like the filler move out.
Yeah.
I'm like, and it's not like, even if you're getting injected, I can't like just all of a sudden push that filler into that cavity I didn't put it in.
Yeah.
You're going to have to like do the same repetition over and over and over. So I'm like, I guess if you're drinking out of a straw for 24 hours a day for like 20 million days, then maybe. But I'm like,
most people drink your Stanley.
Yes.
Drink your Stanley. It's fine.
Yes. Now, I will say some of my patients, though, I have told one girl, do not drink out of a straw because she had very, very small lips. And we had been building on them. And I'm like, just don't touch them. But other than that, I'm like, no, it's
hands
fine.
off. Yeah. Same. I say the same thing.
I know. I'm like, but for any of our listeners, if you have questions on migration or anything like that, like drop a comment down below and make a consultation with one of us. All of us at Weiler Plastic Surgery, all of our mid-levels and providers, we are very well trained on the techniques and actually assessing the patient and what they are, actually needing and if they have migration. So if you're, concerned or anything, come see us. We would love to help you. But yeah. Thanks for coming on today.
Thanks. This was so fun.
Yes. And if y'all like this episode, subscribe, comment, share with a friend who probably needs to hear about migration. And yeah, we'll see y'all next time.